I am Dr. Hugh Melnick, and I would like to tell you about using Thyroflex testing for the diagnosis and management of hypothyroidism. As we all know, blood tests, especially TSH levels, have a limited value in diagnosing hypothyroidism. Many individuals have normal TSH levels, yet suffer with the classical symptoms of hypothyroidism. Likewise, when the level of TSH in the blood is used to determine the ideal dose of thyroid medication, many people still remain symptomatic. Since thyroid blood testing does not detect many cases of hypothyroidism, symptomatic individuals are often denied treatment that would greatly improve their health and the quality of their lives. Unfortunately, many physicians are not comfortable diagnosing hypothyroidism on the basis of a patient's clinical symptoms, especially when their blood tests fall within the, quote, normal range. These physicians require objective evidence that a symptomatic individual is actually hypothyroid before offering treatment. Physicians, as well as symptomatic individuals, must be made aware of an alternative method of thyroid testing that can be used to confirm the diagnosis in symptomatic patients who have normal blood tests. For this reason, it is really of utmost importance to raise public awareness of Thyroflex testing, a little known and underutilized method that can be used for making a diagnosis of hypothyroidism and for determining the optimal dose of thyroid medication for symptomatic patients. The Thyroflex test, developed by Dr. Darrell Turner, is able to determine a person's thyroid status based upon the measurement of conduction velocity through a tendon reflex. You might wonder, what could the speed of nerve conduction possibly have to do with hypothyroidism? The connection was made late in the 19th century when doctors studying patients with hypothyroidism observed that clinically hypothyroid individuals had very slow or absent tendon reflexes. A tendon reflex is a movement of a muscle caused by the stimulation of a nerve that controls the muscle and causes it to move involuntarily. The speed at which this reaction occurs is an indicator of cellular function. The lower the speed of conduction, the lower the cellular energy and function. Cellular function is ultimately controlled by T3, the most biologically active thyroid hormone. Low levels of T3 in the cells result in diminished cellular function, which ultimately cause people to suffer with the clinical symptoms of hypothyroidism. Since blood tests cannot measure the level of intracellular T3, one way to objectively test cellular function is by measuring the speed at which a nerve impulse is conducted through nerve and muscle cells. A slow rate of nerve conduction demonstrates low cellular function and confirms a diagnosis of hypothyroidism. Thyroflex testing can also be used for establishing the optimal dose of thyroid medication for symptomatic individuals. Using the Thyroflex, a physician can immediately see if the patient's dose of thyroid medication is adequate by the velocity of their nerve conduction. When slow nerve conduction is found with Thyroflex testing, an increase in the dose of thyroid medication is needed if the patient is symptomatic, irrespective of blood test results. This is especially true when a patient is taking natural desiccated thyroid, since physicians unfamiliar with it are often confused by blood test results when patients are taking NDT. In my experience, there is an excellent correlation between Thyroflex results and patients' clinical symptoms. As compared to Thyroflex testing, there is a poor correlation between TSH levels in the blood and patients' symptoms, since approximately 40% of patients on thyroid medication have TSH levels in the ideal range, but still experience symptoms. Now let me describe how the Thyroflex test is performed. The patient is connected to the Thyroflex computer by placing a sensor above the middle knuckle of the left hand. A spot above the brachioradialis tendon is identified, where the nerve will be stimulated. When stimulated, the tendon will make the middle finger move involuntarily. The time interval between the stimulation of the tendon and the involuntary movement of the middle finger is measured by the computer. The average speed of conduction is calculated, indicating the level of intracellular thyroid function. This is an example of a normal Thyroflex test, in which the average rate of nerve conduction is in the green zone, which indicates ideal thyroid function. The next Thyroflex result indicates mild hypothyroidism in a symptomatic patient on 120 milligrams of natural desiccated thyroid. This example indicates that the patient's results are still in the red zone, indicating an increase in thyroid medication dosage is necessary. The following example shows a severely hypothyroid individual with very slow nerve conduction reaching the top of the upper red zone. If a patient is taking too much thyroid medication or has hyperthyroidism, their results will be in the lower red zone. The symptoms of hypothyroidism are the result of inadequate levels of T3 in the cells of the body. Low levels of intracellular T3 cannot be detected by the levels of thyroid hormones in the blood. In the hypothyroid state, low T3 levels within the cell cause the cells of the body to produce inadequate amounts of energy, which results in the clinical symptoms experienced by hypothyroid individuals. Slow nerve impulse speed, as indicated by Thyroflex testing, demonstrates low cellular function, which correlates with clinical symptoms. The bottom line is that diagnosing and treating hypothyroidism according to patient symptoms is very effective. Knowledge of the many symptoms of hypothyroidism is the key to its diagnosis and treatment. However, if a physician requires objective proof of the existence of hypothyroidism prior to treating symptomatic patients with normal blood tests, Thyroflex testing can be used to confirm the clinical diagnosis. Furthermore, if a patient is being treated with thyroid medication and remains symptomatic, Thyroflex testing can immediately determine if an increase in dosage is needed to relieve the patient's symptoms. In my clinical experience, Thyroflex testing is more sensitive than our blood tests in determining the optimal dose of thyroid medication. This is Dr. Hugh Melnick, and I do hope that this information on Thyroflex testing will be helpful to those of you who are still suffering with the symptoms of hypothyroidism.